everybody, welcome back. Well, as you know, October is Breast Cancer Awareness Month, and at a time when we shine a light on the importance of early detection. But beyond the pink ribbons and the reminders to get screened, it's also a time to recognize the strength and resilience of those who are fighting or have fought breast cancer. Joining us this morning to offer a little more insight on how far treatment options have come, we have Dr. Ali with us. Doctor, first of all, thank you so much for being here.
Thank you for having me. I think this is a really important topic.
It is. It's so important that we talk about this, and we often talk about catching breast cancer in the early stages, of course, but what happens if it's not caught early? You know,
That's the thing I want to talk about. I mean, just looking back at this last Monday's Medical Monday segment with Lisa Carberg and, Amber Steady from Waterford, she was profiled and how she found out that she had breast cancer while feeding her son, breastfeeding her son.
Right.
And now we're seeing more of these cases of what we call lobular carcinoma, lobular breast cancer.
Yeah.
So the American Cancer Society has seen a slight uptick.
Yeah.
Now, this is a type of breast cancer that invades the milk-producing glands more deeper within, so you really can't necessarily feel a lump. And look, we're seeing it at younger ages, at 31. So yes, catching it earlier is important, but even if you get diagnosed, there are so many more treatments that we have nowadays. And we are now understanding how to, kind of tailor the treatment to the person. So I take care of a lot of older adults, geriatric patients. So geriatric oncology has come a long way, where we customize the treatment to the patient's, physiology. Are they too frail? Are they too, weak? So we can tailor the doses of the chemotherapy to adjust it for their, abilities.
What they can sustain, yeah. So when you hear about somebody who's 31 with this lobular breast cancer that you said is increasing, that's really concerning to hear.
It is.
What is causing this? What do we need to know?
It's hard to really say.
Yeah.
And we really can't pinpoint it on one exact cause.
Right.
I mean, genetics definitely play a role.
Sure.
I mean, we know that the BRCA1 and BRCA2 genetic factors are definitely, even in male breast cancer. We don't even talk about that because we're seeing more cases of men with breast cancer.
Yeah.
So it's important to know your genetic profile, and you can get checked. You can get checked for a regular routine screening.
Right.
But also if you have a strong family history, a first-degree relative. It's important that you talk about, your relative risk with your family history.
Right. And it's important that you take healthy steps too, right? I mean, is
Absolutely.
there anything that we are doing that we can change to make sure that we're...
Well, I can definitely say that cigarette smoking, obesity, believe it or not, people don't understand that obesity can affect any kind of cancer risk.
Yeah.
And once you get diagnosed with cancer, it's not a lost cause. There are, really, you can do the mastectomy, of course. If you catch it early enough, you can do a lumpectomy. But the key thing is your doctor's going to do what's called a biopsy. Where they'll take a little piece of the tissue, they'll look under the microscope, and they'll analyze it for genetic markers. I'm sure you've seen all these commercials for these new pills that you can take for breast cancer. Now, that's for specific genetic mutations.
Right.
I tell my patients, think of it, as trying to target exactly the weak spot of the tumor. Think of it as shooting the tires of a car so it can't accelerate really fast. So it doesn't cure the cancer, but it can really buy you some more good time.
Yeah.
But it's very important that you talk to your oncologist, explain to them and ask them, what is this treatment going to do to me? What are the side effects? I take care of my patients. I do the supportive care. So I manage the side effects of chemotherapy. And a lot of times people don't know that they can ask their doctor, well, is this chemotherapy going to make me bedbound or wheelchair bound? Is it going to affect my memory?
Right.
So people in the 75 and older bunch, I always tell them, what we can do is a comprehensive pre-chemo assessment to assess your cognition, your nutrition, your physiological fitness. And that is the new trend. So then we can customize the chemotherapy.
It's so important. People don't realize they have control over that. You just need to talk to your doctor.
Exactly.
Doctor.
A lot of my patients don't know that you work with your doctor as a team.
As a team and do what's right for you. Dr. Ali, thank you so much for your time today.
Thank you so much,
important we talk about this for sure.